All right, so blood collection in special populations. So pediatric patients. So collecting blood from a pediatric or a child can present both technical and psychological challenges because the greater technical expertise is required to perform phlebotomy on children than on adults. You need to make sure that you can master the collection on adults first, and then you can move on to children and infants once you have that technique down. The special psychologic considerations, children have a lower total blood volume than adults do. So for example, a 150-pound adult has about 5 liters of blood. So a 10 milliliter sample represents about 0.2% of total blood volume, whereas that same sample from a 1-year-old actually is going to represent 1% of the total blood volume, and in a newborn it's going to represent about 3% of total blood volume. So the younger and smaller the child, the lower volume that can be safely withdrawn. Infants and children should not have more than 5% of their blood volume removed within a 24-hour period unless medically necessary. So that would be up to the physician's call. So removal of 3% or less is going to be the preferred maximum. A dermal puncture, so in that heel or finger, requires a very small amount of blood, and it is actually the most common pediatric collection procedure. However, it cannot be used when you need a lot of blood. So if they have a lot of testing done, we can't do a dermal puncture. So like for blood cultures, or if they have to have coagulation testing or blood bank testing, like for a cross match, we can't do a dermal puncture for that. We're going to have to do a venipuncture. So for blood culture in infants and small children, a sample of 1 to 5 milliliters is required. Children differ in their levels of understanding and their ability to cooperate in anxiety about medical procedures. So in addition to the fear of pain, children may be anxious about being in the hospital and away from home. So we need to try to keep them calm, comfortable, and try to make it as painless as possible for the patient, the child, as well. Make sure you prepare your equipment ahead of time before you encounter the child, because they can have some strange reactions when they start seeing this stuff. So if possible, you're going to perform the procedure in a room that is not the child's hospital room, such as a procedure room. You want to be friendly, of course, cheerful and empathetic with them, and explain what you will be doing in terms that they are appropriate for a child's age. So you can't come in and say, I'm going to perform a venipuncture on you, because they won't know what that means. So you need to say, we need to get some blood from you, in your arm. You'll find the terms that work for you when you're working with children. So make sure you kind of get that down before you go in. Make sure you watch other people who've been doing this for a while. That'll kind of help get your nerves cleared as well. Make sure not to say to the child that it will not hurt, because it will a little bit, right? You have a needle going in your arm. So explain that it will hurt a little bit and that it's okay to say ouch or even to yell and cry, but make sure you let them know and emphasize that they need to stay still. That's going to be the hardest part. You can give the child choices whenever possible to help increase the child's feeling of control. You're going to use the shortest possible needle for the procedure, and you're going to try to keep it out of sight for as long as possible, because sometimes when they see that, that's when they start freaking out. You're going to try to distract the child just before the actual stick, so that they're looking away as well. If there are parents or siblings in the room, they can also help depending on the circumstance, so they can help hold the child so they don't move. They can help distract them. There's things that you can do to try to help prevent the patient or the child from going crazy. During the draw, you're going to tell the child how much longer it will be. So if they have one more tube or just one more second, by doing this, you can help keep the child's anxiety from building during the procedure. And then afterward, you're going to praise that child, even if they did not cooperate as well as you wanted to, and offer them a small reward like a sticker or something that your facility has for them. Involving the parents and siblings. So like I mentioned, they can help distract and comfort the child. You can have the sibling or parent offer them a reward as well. Parents who are present during the procedure can help, like I mentioned, in several ways. So they can help distract, they can help hold the patient, help comfort them. You can ask the parent whether the child has had blood drawn previously, and if so, what helped in that circumstance. And some parents may actually prefer not to remain with the child during the procedure because they don't want to see their child in pain or freaking out. Sometimes it makes it worse. And then if the child sees the parent like that, then the whole thing is just going to go downhill from there. So make sure you kind of get the feel of the room, feel of the patient, the parents, everybody involved to kind of see how it's going to go. Identification of newborns. So on their ID bracelet, newborns may be identified by only their last names, like baby boy or girl Smith. As always, you're going to use that hospital ID number and not the name as the ultimate proof of the ID. So when there are twins, another issue that could occur, you need to be super careful with them because they're likely going to have similar names and ID numbers because they were born, close to each other. So make sure you're double, triple checking those as well. Supplies. When performing the venipuncture, you're going to use shorter needles on children if possible, and use the smallest gauge as well for that testing. Butterfly needles and smaller partial filled tubes can be used for pediatric draws, and take along a selection of rewards like I mentioned earlier, stickers or small toys or whatever your facility has for these types of patients. Anesthetics. Sometimes you can use a topical anesthetic cream that can be useful for patients. The most commonly used agent is an E-MLS, or it's a mixture of lidocaine or prilocaine. Anesthetic is not recommended for PKU testing, and we'll just talk about this later. But a lot of times you won't need to use the anesthetic cream, but it's an option sometimes in your facilities. So immobilization of infants and children. So immobilizing your pediatric patients may be necessary for their safety and your safety. Sometimes kids come flailing and they somehow turn into the Hulk and get super strong. Sometimes you have to get help holding those children. So older children may have self-control to keep from moving, but a parent's care and attention can still be beneficial during the draw. So even 10-year-olds, things like that, you just don't know sometimes when it will occur. For newborns, so you can wrap newborns or very young infants in a receiving blanket, and that is usually sufficient enough to keep them where you want them. They're not strong enough to work themselves loose during the procedure, and for the most part, they're going to stay still because you have them wrapped or swaddled. Older babies, toddlers, and young children, these are the ones that usually need to be restrained. Lots of times we'll have somebody come with us to help hold or ask the patient or a nurse to help as well. So once you get out into your clinicals, make sure you observe and see how that is done because we don't want to completely wrap them up and restrain them. There's certain techniques that you will use for this. Pediatric draws are done with the patient either seated in the lap of a parent or another assistant, like I mentioned earlier. For the child who is seated, the parent can hug the child's body and cross his or her legs around the child's legs, and that will help to prevent kicking so you don't get kicked. And the arms, holding the arms so we can draw without being swatted away, because if you have a needle, kids can obviously hit it, and that would then hurt them, hurt you, could hurt the parent and anybody else in the room as well. If the child is lying down, the parent or assistant can lean over the child and it can hold the unused arm securely so we can get the blood draw. For a dermal puncture on a pediatric patient, the procedure is in your book. As you learned in that chapter, heel puncture is preferred for children younger than 1 because the tissue overlying the finger bones is not thick enough for safe collection there. If they're over a year, generally you can use the finger. And that chapter may not be correct, so double check in your book for that. Special considerations. So the ID band must be present on the infant if you're drawing an inpatient. Keep your equipment out of reach of the patients. Somehow toddlers and babies become these kung fu ninjas and they're able to grab stuff without you even knowing. So make sure you keep it out of reach so that doesn't become an issue. You can warm the heel for 3 to 5 minutes using a heel warming packet, and that will just help with the blood flow. Avoid using adhesive bandages on these patients because they can, well, if it's on their finger or even feet, they are very flexible. You could, pose the risk of choking. And then you're also going to document the collection as well. This is going to be based on your facility's protocols, but there may be a nursery log sheet to show that you completed it. It may just be something in the computer that you fill out. But either way, you're going to have some type of documentation showing that you did collect that sample. For neonatal bilirubin, so bilirubin is a substance that is produced by the breakdown of red blood cells, and this occurs in everybody. So the liver is actually responsible for further processing of bilirubin so that it doesn't reach excessive levels in the blood. Excess bilirubin levels commonly occur when the mom and child have mismatched blood groups, and antibodies from the mom can break down the infant's red blood cells a little more frequently than we want, which would then increase bilirubin levels beyond the infant's capacity to process it. So when the bilirubin is slightly above normal in a newborn, a BiliLite or ultraviolet light treatment can be used. So there can be a buildup of bilirubin, and that causes a term called jaundice, which basically means yellowing of the skin. And if it gets untreated, it can actually lead to brain damage, and it can cause a condition called kernicterus. Collection precautions. So bilirubin is actually light sensitive, so we want to protect that from light. You are going to want to try to keep these things in mind when you're drawing for bilirubin. So BiliLites should be turned off during the collection, so you'll know it kind of looks like a black light when you walk into the room. You're going to want those turned off while you're collecting it because it could affect the results. The specimen should be shielded from light using an amber colored container, aluminum foil, or a heavy paper that's actually going to cover that container so light cannot get in. Samples for bilirubin testing are frequently collected as timed or stat specimens. So there is the potential of hemolysis in the sample as well. So hemolysis of the specimen can falsely lower the result. So you need to make sure that you are using those precautions to not have a hemolyzed sample. And then, of course, collection times must be recorded exactly to track the rate of bilirubin increase. So the physician is going to be watching that, and they're going to want to know, in 4 hours, what did it do? Did it go up? Did it go down? By how much? Things like that. So it's very important to make sure that you are documenting appropriately. So neonatal screening. So the neonatal screening tests are required as part of a mandatory state-based public health program. These tests include screening for hypothyroidism and PKU. There are other diseases that are screened as well, and that includes galactosemia, homocystinuria, maple syrup disease, and biotinidase deficiency. These tests are used to detect inherited metabolic disorders that can cause severe brain damage or other impairments, and can allow for implementation of early intervention treatments. Specimen collection. So the blood for this is collected by a capillary heel stick on special filter paper. Recent studies have shown that the levels of phenylalanine are significantly different between capillary and venous samples. So generally, it's going to be a heel stick, and we would just document on their time, collection, stuff like that on the paper. The filter paper is supplied in a kit that is provided by the state. And when you do it, you'll know what I'm talking about, but it's got like 4 to 5 circles, and you have to make sure you collect those appropriately. So when you use that paper, you don't touch or contaminate the area inside the circles, because that could potentially alter the results. To collect a sample for neonatal screening, first you're going to perform that routine heel stick. You are going to wipe away the first drop of blood just like you would any other time, and then you're going to apply 1 large drop of blood directly onto the circle. The drop must be evenly spread, and you don't want to blot it on there either. So you don't want to touch the paper against the puncture site, and you do not want to apply successive drops onto a single circle because that could cause overlap. which the state lab will actually reject. You are going to air dry the sample on a dry, clean, flat, horizontal, non-absorbent surface for a minimum of 3 hours, and it's going to be kept at room temperature and away from sunlight until it is delivered. Causes for rejection can include use of an expired specimen collection card, collection date missing, so if you don't fill out all the appropriate information on that card. Q&S, so quantity not sufficient, so the blood submitted doesn't fill the holes or fill the circles appropriately. The blood is not completely soaked through the filter paper, or if it's contaminated or discolored, such as putting one little drop in another little drop and another little drop, that can kind of make it be discolored and cause overlapping as well. Another reason for rejection, blood is caked, clotted, or layered. Patient demographic information is missing, so once again, the form is not filled out appropriately. If the form does not match that of the blood circles, or if the specimen is too old on receipt, so if it's received more than 2 weeks after collection. Another reason it could be rejected is the requisition form is received, but there is no blood sample. The specimen submitted on improper collection forms, improper drying, specimen torn or damaged during transit, and sometimes laboratory accidents. So if something was spilled on it, or, who knows, anything could happen, right? So venipuncture in newborns. So when a larger volume of blood is required, blood can be collected from newborns or children younger than 2 years by venipuncture. So special considerations for those. So you will not use a tourniquet on these patients generally. Instead, you're going to clasp the infant's wrist between your middle finger and forefinger and allow the infant to encircle your thumb with his or her fingers. You can use a 23 gauge needle, and you're going to gently insert the needle 3 to 5 millimeters distal to the vein, slowly advancing until you see blood in the hub of the needle. Once blood begins to flow, you can release your hold on the needle and use your free hand to pull gently on that syringe. An alternative to using a syringe in tubes is to let the blood freely flow into the appropriate microcontainer tubes. Although that's usually not what happens. So after withdrawing that needle, you're going to apply firm pressure with sterile gauze until that bleeding stops. Once again, you're not going to use a bandage because the baby may remove it and put it in his or her mouth. You're going to follow the procedure for using a blood transfer device and filling all the appropriate tubes, and then you are also going to record the volume of blood collected per your facility's protocols, and once again, making sure you're documenting date, time, initials, all that stuff that you would on a normal sample. So geriatric patients or older elderly patients. So as with infants, collection from geriatric patients can present both physical and psychological challenges. Working with geriatric patients also can bring considerable rewards for phlebotomists who take time to get to know their patients as people. So they had a life before, and they still have a life. So getting to know your patients, especially if they're an inpatient and have been for a while, or if they're an outpatient and they come in all the time, it just makes it more enjoyable for you and them if you take that time to get to know them. Geriatric patients are also the most likely clients in the adult daycare and home care settings as well. Patients can be found in long-term care facilities, and they are often coping with special challenges that have led them to be there. So take the time with them, understand what's going on. They're people too, and we were always taught to treat them like they're your grandparents. Because they're somebody's probably. So just kind of keep that in the back of your mind as well. Some of these challenges that they may be facing include chronic illnesses, loss of mobility, or having cognitive impairment or dementia. Physical changes in elderly patients. So we're going to treat the skin of geriatric patients gently. The skin changes a lot as we age. So the amount of collagen in the skin is reduced. So the skin becomes less elastic, and then the layers of the skin actually become thinner. Bruising is going to be more likely in these patients, and it's going to take longer to replace these cells. So the healing is actually going to take longer as well. Veins in these patients are often closer to the skin. Therefore, the penetration angle of the needle needs to be reduced in these patients. Common disorders for geriatric patients is hearing loss. So you're going to begin your encounter with the patient by speaking slowly and deliberately to be sure the patient understands. And just because they have hearing loss doesn't mean they can't hear you, but just make sure that you're speaking in a tone and a speed that they can understand. Visual impairment is also common and can impair the patient's ability to comply quickly or easily with your requests. So just keep that in the back of your mind as well. If you're telling them to sit in this chair, they may be having trouble seeing it. So you may need to help them, help guide them, just kind of be there for them, really, is kind of what this boils down to. There are also a number of conditions, including Parkinson's disease and stroke, that can lead to unclear speech. So lots of times if you take the time and listen to them, you can understand what they are saying. But sometimes you may need to get someone to come in and help you understand what they're saying, just in case you don't want to miss anything. Arthritis also affects a large percentage of geriatric patients, and arthritis could prevent your patient from fully straightening his or her arm as well. So don't force that patient's arm flat. You have to ask the patient if that's okay, if it's uncomfortable, things like that. If the arm cannot be straightened, a butterfly may be used in the antecubital area. Many patients may be on anticoagulant therapy or blood thinner for previous heart attacks or strokes. These patients are actually going to have an increased risk of hematomas, and they also are going to have an increased risk of bleeding longer after the venipuncture. Tremor is common in advanced old age and may make it difficult for the patient to hold his or her arm steady during the blood collection process. So they may be, shaking while you're trying to draw that blood. So if that occurs, you're going to want to grab someone to kind of help steady their arm for you. Mental impairment in elderly patients. So when people get older, sometimes they become forgetful. They may have confusion, and dementia can also occur. These patients may have difficulty communicating and complying with your request, and they may also become combative. So sometimes you need to get assistance from the nurse to help with the patient. Make sure you are aware of your facility's protocols and policies for use of restraints, and make sure you always check with that nurse before those restraints are loosened if they are used. You're going to use the wristband, not the patient's response, to confirm patient ID, especially if they're showing signs of mental impairment. And some patients may be in restraints to prevent them from hurting themselves or others. So as mentioned, they may already be in a restraint when you walk into the hospital room. So don't loosen those without the nurse, checking with them first, because they may be there so they don't hurt themselves or somebody else. Special considerations for blood collection. Be especially careful with patient ID. So make sure you rely on that ID bracelet if there's any doubt that the patient understands you. Be aware of the frequency of blood draws, because the risk of anemia is higher in geriatric patients. Be especially gentle when applying pressure to avoid a bruising, because like mentioned earlier, they will bruise easier. And if you're performing venipuncture, you can apply the tourniquet over clothing, and that will help to reduce bruising as well. To improve access and comfort, you can place the arm on a pillow and have the patient grip a washcloth while the arm is supported on either side by rolled towels, and that will just help keep the arm where you like it, and it's more comfortable for them as well. Make sure you anchor that vein firmly, as veins have a tendency to roll once patients become more elderly. You can use a smaller needle or a butterfly needle in smaller tubes to help with patients who have smaller and fragile veins. Conditions requiring blood draws for extended periods. So there are certain blood draws that need to be performed, daily, weekly, multiple times a day, things like that. Some examples of these are anticoagulant therapy, if patients have leukemia or other terminal cancers. Those are all examples of why they would need their blood drawn more. Patients requiring blood draws for extended periods. Once again, frequent blood drawing in these patients often causes the most commonly used sites to become damaged from overuse. So the veins may become hardened, and they may become difficult to penetrate with the needle. The skin may also develop some scar tissue as well. In some of these diseases, the trauma to the skin from frequent needle puncture may cause it to become delicate and tear more easily. So special equipment we can use in the ICU and emergency room. So patients in the ICU or ER are likely to have some type of vascular access device or indwelling line in place that can affect your collection. So if they have a line or anything like that, a tube that is inserted into either a vein or an artery and is used to administer fluids or medications, monitor blood pressure, or draw blood. So if they do have one of those vascular access devices, sometimes a nurse or somebody can draw blood out of it. It's usually going to be done by a physician's order, because sometimes it's just not appropriate to do. Sometimes the phlebotomist may be asked to assist with the collection or handle the sample after collection, but we would never be drawing out of these types of devices. So types of these vascular access devices. So the name of the vascular access device is generally based on the location of the tubing in the vascular system. So a central venous catheter is also called a central venous line, is actually the most common type. The central refers to the large veins emptying into the heart, into which the CVC is inserted. An implanted port is a chamber located under the skin and connected to an indwelling line. A peripherally inserted central catheter or a PICC line is threaded into a central vein after insertion into a peripheral vein using the basilic or cephalic access from the antecubital area. An arterial line is placed in an artery for continuous monitoring of blood pressure or frequent collection of samples for blood gas testing. A heparin lock or saline lock is a tube temporarily placed in a peripheral vein to administer medicine or draw blood from. An arterial venous AV shunt is an artificial connection between an artery and a vein. And an external AV shunt consists of a cannula with a rubber septum through which a needle may be inserted for blood drawing. So drawing from a vascular device, again, we generally are never going to be drawing from that. This is going to be a nurse who has been specially trained, and it's only going to be done with a physician order. So if the physician has not okayed it, it is not going to be done. So we are going to have to draw from the patient like normal. They will never use a syringe larger than 20 milliliters because pulling on that plunger can actually create enough vacuum that would actually collapse the whole line. These vascular access devices are often periodically flushed with heparin to keep that line open. And the order of draw should be blood cultures, anticoagulant tubes, and then clotted tubes. And a lot of times with these, they're also going to draw, 5 to 10 milliliters of blood and then actually waste it, throw it away, so that way it's not contaminated. Working with intravenous lines or an IV line. So you come into a patient, so if you come into a patient room and they have an IV line in place in one arm, blood should be drawn from the other arm whenever possible. If this is possible, or if there are lines in both arms, the following points need to be kept in mind. So you are going to have the nurse turn off the IV drip before the draw for the appropriate amount of time for the IV to clear the medications. You're going to apply the tourniquet distal to the IV insertion site. You're going to select a vein distal to the IV insertion site and different from the vein with the IV line. Again, you're going to discard the first 5 milliliters of blood because it could be contaminated with that IV fluid, and we don't want that on there. Once you have completed the draw, you're going to make sure you let the nurse know so she can turn that IV back on.